The Bureau of Labor Statistics says healthcare professionals are overwhelmingly female, but only 2% of them are non-white.
We have Matthew Martinez to talk about issues surrounding underrepresentation in the healthcare field. Down to the Wire is right now.
Thanks, Donna and Anthony. I'm Clara Jansen, and welcome to tonight's edition of Down to the Wire. I'm joined here tonight by Matt Martinez, who published a story this week about women of color in the healthcare industry. Hi, Matt.
Hi, how's it going?
Good.
Thanks for having me.
Yeah. So, women of color in the healthcare industry, okay, that's an issue, but how does it affect us here on Marquette's campus, and how does it involve Marquette's community?
Well, you know, when we originally set out to start reporting this story, we were considering doing kind of more an in-depth look at the issue in general, lack of representation for women of color in healthcare. And we were going to do that kind of by interviewing different people around the community in Milwaukee as well. We ended up doing that with Kenesha Williams, an ER nurse from Freighter, but we were also going to interview some undergrads and stuff like that from different colleges within Marquette as well, which we also ended up doing. But through the course of our reporting, we found out about this program called HCOP, Health Career Opportunities Program. And we found out that it was going to be shut down because it lost its federal funding last year. And I think that is a very relevant topic, especially regarding this issue, because HCOP used to provide opportunities for people from underprivileged backgrounds in order to try and enter into the healthcare field. And I think, you know, kind of the piece as a whole is representative of a lack of opportunities and stuff like that, because that's where the main issue lies, is there.
Okay, so what kind of numbers and data did you come across while you were studying this issue?
Well, you know, it's really tricky to try and find data on stuff like this because the Bureau of Labor Statistics really doesn't publish things very specifically for women of color, and that's just because of the methodology in which they report numbers and stuff like that. Thanks to different organizations like the Association of American Medical Colleges, we know that currently, of current practitioners, only 2% are black females. If you look at BLS data, you can kind of get an idea of what's going on, but it really shows more of a racial disparity in general. In 2003, registered nurses were the highest, biggest healthcare occupation, and 92.1% of registered nurses in 2003 were females, 9.9% were black, and 3.4% were Hispanic or Latino, but those numbers are for the population as a whole, not for women or men specifically. If you look at the numbers from 2017, 12.3% were black, 6.9% were Hispanic or Latino, but you saw a dip in the number of women in healthcare at 89.9%. So it's very difficult to nail down, but it is indicative regardless of kind of a problem for different races in general. Yeah. And
so Marquette lost its funding this year for that special program?
Correct. Yeah, they were originally supposed to compete for the program. A number of colleges get it, but you kind of have to score in a certain manner and do different applications and stuff like that. And they ended up not getting that just based on the fact that the program did not give them that money. So,
okay.
Yeah.
Well, that's about all the time we have for tonight. Back to Donna and Anthony.